HMPV spreading in China. Experts say no pandemic risk despite COVID-like symptoms. In a world still recovering from the impact of COVID-19, any virus that mimics its symptoms can naturally raise alarms. This time, the focus is on human metapneumovirus, or HMPV, which has been spreading in parts of China, particularly affecting children under the age of 14. Reports from global media point to a rise in cases across China's northern provinces, with unverified claims on social media suggesting overwhelmed hospitals and crematoriums. However, no official emergency has been declared by China or the World Health Organization. HMPV, first identified in 2001 by Van den Hoogen in the Netherlands, belongs to the same family as respiratory syncytial virus. According to the American Society for Microbiology, this virus is a significant cause of respiratory illness in young children and can trigger conditions ranging from mild cold-like symptoms to severe complications like bronchitis and pneumonia. The virus spreads primarily through respiratory droplets from coughing, sneezing, or talking and can also be contracted by touching contaminated surfaces. Dr. Sanchen Roy, senior consultant in internal medicine at Apollo Spectra, explains. HMPV typically causes mild symptoms, such as nasal congestion, cough, and fever. However, it can lead to more severe infections, especially in children, older adults, and immunocompromised individuals. Despite its similarity to coronavirus in terms of symptoms, Indian experts are dismissing fears of a large-scale outbreak. Former ICMR scientist Dr. Raman Gangakhedkar states, HMPV has been circulating for years, and most people have developed immunity. It primarily affects young children under 5 or immunocompromised individuals in rare cases. It's not capable of causing a pandemic. Doctors across India are also not observing any significant rise in respiratory illness cases. Dr. Kirti Subnis, an infectious disease specialist at Fortis Hospital, notes, there has been no noticeable increase in cases. While HMPV behaves similarly to coronavirus, it's not a new pathogen, and infections are typically short-lived, lasting 3 to 6 days. Pulmonary medicine expert Dr. Arjun Khanna from Amrita Hospital echoes this view. In most individuals, HMPV causes mild, self-limiting upper respiratory tract infections. Serious complications are rare and usually confined to those with compromised immune systems. The Directorate General of Health Services in India has clarified that HMPV is like any common respiratory virus causing cold symptoms and stresses regular preventive measures rather than panic. Preventing the spread of HMPV involves basic hygiene practices, wearing N95 masks, regular hand washing, avoiding crowded spaces, and maintaining respiratory hygiene. Dr. Niranjan Patil from Metropolis Healthcare highlights that since 2017, advanced diagnostic tools have been available to detect HMPV, helping mitigate its impact. Finally, experts remind us that, while no vaccine or specific treatment exists for HMPV, early detection and vigilance are crucial. Parents should watch for prolonged cough, breathing difficulties, or persistent fever in children, and individuals with chronic respiratory conditions must take extra precautions. The consensus: stay cautious, but there's no need for alarm.